Okay, we are getting our attendees right now. I would say let's start. So welcome everyone. Today's event is the introduction to the Polish health ecosystem. My name is Sofia Hansen. I'm from Startup Campus. We are organizing this program with the support of the V4 International Fund and in cooperation with 3 V4 countries, Poland, Slovakia, and the Czech Republic. Our partners are Civitta SK, Startup Hub Poland, and DEX Innovation Centre. Exactly. So today our topic is going to be the Polish health ecosystem. We have different governmental and private experts with us today that are going to be talking about their country. So a bit about Startup Campus. So we are based in Budapest. We have offices in Berlin and in London. We are one of the largest accelerators in Hungary. We are running lots of university projects and building the startup ecosystem in Budapest and in Hungary overall. And our offices in Berlin and London are helping Hungarian companies to accelerate their businesses into European markets. Our program that we're listening to today, the V4 Global Export Readiness Programme, is one that supports 8 chosen healthcare startups, and we want to help them to accelerate their startups from the V4 region into the Western markets and help their growth, their business development, and their journey. So throughout the program, we have 13 webinars that are open for all, and our 8 teams are participating in personal consultations as well, and will be able to attend a demo day at the end of the program. So that's all from me, and I would like to give the floor to today's host, Kasia from Startup Hub Poland. And thank you everyone for accepting our invitation and joining us today. I hope you enjoy all of the presentations. This webinar is going to be recorded and it's going to be published a few days after this event on our YouTube channel. So good luck to everyone and thank you for coming.
Hello everyone. I don't know if you can see my presentation right now. Can you see it?
Yes, it is working.
Yeah.
And I have also given you the host permission from now on, okay?
Okay, great. So everyone, it's really nice to meet you. My name is Skoneczna and I'm from Startup Hub Poland. I'm actually here with the CEO of Startup Hub Poland Foundation in Poland, Maciej Sadowski. And we're very thrilled to see you here and to have a chance to meet with each other online. Today we're here to talk about Polish ecosystem, Polish startup ecosystem, focusing on medtech startups. And the whole event is funded and supported by Visegrad Fund, which I had to say, and it's very important to acknowledge at the very beginning. Partner organizations of this event are Startup Campus, about which Sofia had just told you about, and Startup Hub Poland. We're a foundation and that's been running for more than 9 years now, and we have lots of experiences with leading acceleration programs here in Poland for high-tech innovation startups. We're focusing on high-tech and deep tech. And I don't know, Maciej, is there anything else that you want to say about Startup Hub Poland? Are you there?
Yes, hello, Kasia. I'm very happy to be today with you. Actually, after your beautiful introduction, there is not much left to say about our organization. I rather want to focus for just a second, maybe 1 or 2 minutes, on the mission that bound us all here during this meeting of International Visegrad Fund. And thank you, Sofia, for wonderful hosting, for great preparation, because in order to gather so many first league architects of Polish health tech sector, there are really lots of preparations needed. And thanks to Katarzyna, Kasia, and Sofia, and teams from all 4 sides of the wire, we managed to present you today our friends and our mentors, actually those people who are personally responsible for kicking off the ecosystem of health tech innovation in Poland. And as far as Startup Hub Poland already has been mentioned by Kasia, we are a very humble organization, a team of seven evangelists, team of seven experts in field of technology brokerage, in field of VC and corporate connections for startups. And what we are trying to do here in Poland is to create comfortable conditions for all international pioneers of great technologies to come to our country, also to other Visegrad region countries, even from outside of this region. So very often we are talking about startups from Ukraine, from Belarus, from Russia, but also from different geographies. In some of our programs we hosted guys from India, from Canada, from Mexico, and from United States, to give you only an example. In our recruitment, when we are proposing an open call for startups in different sectors, in different verticals, we see sometimes so original directions like Vanuatu, deep in the Pacific Ocean, or South Africa, Republic of South Africa. So what I can say already after 10 years of our work here in Startup Hub Poland is that our region becomes more and more interesting, I would even say sexy, for those of startup founders who are very early stage and who are particularly interested in developing R&D projects. So, of course, looking at the list of unicorns, you will see eObuwie or Dog Planner or CD Projekt Red or Allegro. These are all ICT-driven projects, but my deepest wish and deepest, let's say, dream about how this region can benefit to the global affairs of high-tech ventures is that we will actually very shortly become also biotech or medtech or health industry hub for the region of Europe at least, and maybe global-wise. And of course, I understand that we should not have a hegemonic dreams of being the localization number one. What we can do together, and this is why I'm so happy that this format actually takes place and that Sofia and Kasia and other colleagues have invited us to work together, is that maybe in the chain of development of given innovation, we will just have a paramount position in one single element of the chain, which is already enough. Generally speaking, it's a very banal thing to say, very trivial thing to say, but innovation is a teamwork and work that happens in sequences. So there is no shame or no dishonor in the fact that the principle of the technology is being, for example, invented, let's say in Ukraine, then for the seed stage, the technology and the teams of founders, team of developers go to Poland, for example, or to Hungary or to Czech Republic. Of course, me being Polish and a young guy from Warsaw, I really like to see startups here in our city. But it's really good place to develop certain elements of your technology. For example, make a proof of concept, and then, of course, if a startup has interlocal or even global ambitions, and it should have, the doors to Western Europe and the doors to Atlantic hemisphere of business is also open through our hub, through our region. So there is very natural that startups are going in a certain moment, for example, to Canada or to United States, or sometimes to Arabic states or China. Maybe China actually in this week is quite a risky topic to mention, but I see this movement of innovation of startups as far as they are developing to very different locations. So I am happy that maybe thanks to the fact that we have invited super great speakers, and I will introduce the first speaker, the first expert who will be telling us about his experiences, which are actually quite unique. You will see that, I hope we will see all that from this kind of meetings, from this kind of evangelization or education, we will get more and more interactions and contacts between venture capital funds, startups, and scale-ups here in our region in order to attract greater money, greater investment, high-risk money, high-risk ventures. Having said that, Kasia, if I'm allowed, I will go directly to introduce our first guest. Not yet.
Yeah, you're not allowed quite yet. Just in a second, I wanted to also mention our partners organizations in this partnering in this project, which are Civitta from Slovakia and DEX Innovation Centre. We cannot forget about them. Today's webinar is about Polish ecosystem. So both DEX Innovation Centre and Civitta will have their chance and to introduce their ecosystems during other days and other webinars. However, they are also important factors in this project that would never be able to exist without them. So after saying that, I think I can give you the floor back, Maciej, because you can tell the most about our next speaker, much more than I can say, because you guys know each other for quite a long time. So the floor is yours again. Let me just mute.
All right, thank you, Kasia, very much. And of course, thank you for mentioning all our partners. I also want to tell you that, as Sophia said at the very beginning, this meeting is going to be recorded because evangelization has, I don't like this word, but you know what I mean. This process only has a purpose and deep sense if more and more people can see it. So as I understand shortly, on the YouTube channels and social media, all of other people interested in development of medtech in our region and in Poland in particular, because today's chapter is about Poland, will be able to come back to it, listen to it, and of course later together with Kasia and all team of Startup Hub Poland, if only you have questions or you want to meet our experts or interact with their companies, we will help to enable that, though they are very busy people. Talking to busy people, I want to welcome the busiest, if this conditioning is correct in English, the busiest person from my little network, and also a mentor, my personal mentor. I hope he will not correct me if I say that also a friend. Definitely he will not correct me if I say that he is a community and ecosystem builder in Poland. For example, our humble organization 10 years ago has been created because of his idea. It was Marek Borzestowski, who I'm referring right now to. And before he will unmute his microphone and say hello to you as well, I want to say, Marek, just a few words about my recollection, my perception of our milestones of our friendship and our work together. So talking to the purpose of today's meeting, I remember it was winter 2011 where Marek Borzestowski called me for a second, and it was evening. I was in a bar having some beers with friends, and he said very shortly, without even saying hello, Maciej, do you think that our region is participating in the global competition for talents? And I said, wow, what a surprising question that late at the evening. And he said, yeah, I'm really interested in your answer. And I said, well, I'm not prepared to give you this answer professionally, but I believe that no, we are not in this trend. And Marek said, okay, thank you. He hanged off the phone, and then after a few days he called me again and said, Maciej, actually I think you are wrong in your assessment. We are participating in the global competition for talents. We are namely the provider of talents. At our universities, at our academias, people are learning how to be great specialists in certain domains, for example, health tech, and then immediately they are packing their luggages and going to the nearest airport and going to, name it, US or Canada or Great Britain or Germany, which is very close. And then the all talent that they represent is being monetized and reproduced for a good purpose, for an impactful purpose somewhere else. And Marek said, let's create an NGO that will try to change this phenomenon and maybe keep some more talent in Poland. But, and this is the last sentence of the introduction of Marek, probably in the terms of our discussion, our interview today, I will have chance to give some additional points of his career, his professional career. But Startup Hub Poland was, of course, not his first project. I remember this company, which is well known to Polish colleagues, but this video will be seen also by friends from another countries. Marek has created a company in between 20th and 21st century called Wirtualna Polska, which is a Polish equivalent to Yahoo. Nobody knew what internet really is and how we can play and benefit from it. And Marek gave us an answer, creating a company that is right now one of the biggest title in Polish media and internet sector. It was many, many years ago. When exactly, Marek, have you founded this company?
Hello, everybody. Maciej, thank you for the introduction. That is very kind of you to speak of me in such a warm and nice words. Actually, I started my first venture in just after graduation from the Technical University of Gdańsk, it's north of Poland. But in the meantime, I worked in the Nuclear Research Center in Germany, and in this Nuclear Research Center in Karlsruhe, we decided to build something similar to Yahoo, but in our language, and it was Virtual Poland, and that was 1994. And I ran the company for 10 years and then exited to French Telecom in year 2005. So I had a long story with being an entrepreneur. But after that, since then, I started my career as a venture capitalist. And together with some friends from Israel, from well-known Israeli venture capital called Giza, we set up Giza Ventures here in Poland to finance companies with technologies that have potential for the global rollout. And this is the way how the Israeli market works. And they have local talents, but the projects usually target the global market. So this is where we were focusing at the very early stage, because it was like 10 years ago. So that was one of the first venture capitals in Poland. We made several investments, almost 50 investments in Poland. But in the meantime, I decided to become an entrepreneur again and join one of the biotech companies that we initially funded. And this company is called Nano Group, where I'm a CEO at the moment. Nano Group is a group of biotech companies, biotech startups, solving, problems from ranging from oncology to organ preservation tools. So that's shortly my professional career. And Maciej told me that our meeting would be in the form of discussion.
Yes.
So I'm eager to answer Maciej or attendees' questions if there are any.
Yes, so I will definitely exercise my privilege to ask the first questions. Then around 2 p.m., maybe 10 to 2 p.m., Kasia Skoneczna will take the lead in also giving the floor to other attendees who are today. As I said, these are only participants of the project, but so I really, how to say, I really want to ask you to ask good questions, because these questions should be heard also online later when the organizers will put all of our today's meeting online for the benefit of the whole industry. But first, my questions exactly. So Marek, I will definitely go to Nano Group, because today we have invited you as a chairman of the board and the CEO of the Nano Group, the most interesting example of former startup which transformed itself into main market stock company listed publicly. But first, let me just, since you mentioned your venture capital periods, your venture capital adventure, I wanted to cover a little bit on this topic. Well, you also have been investing in early stage medtech startups. Can you just tell us a little bit in Poland and Israel, because Giza Polish Ventures, as you said, was an international fund. What was your main approach towards the very, very rich deal flow that Giza had? I know that you were selecting one upon 500 or 1,000 projects that actually sent a pitch deck to your fund. So what was the main point for you and your team to distinguish which health tech project is actually worthy your money and your attention, money and attention of your limited partners, rather than 10 or 20 or 50 other projects?
Well, this is a very good question, actually, and answering this question, it's not easy one, because in a decision process, when you get a new example or new idea for a company or a product, you have to analyze it from the various kind of perspectives. And there is obviously a technology perspective, where you due diligence the projects from the technological perspective, whether it's worth investing in this technology. Is it a breakthrough technology? Has it a potential for being patented? And isn't it just a copy or or a technology that has some problems with scaling or something? So only the technology due diligence does not answer the question. There are other perspectives, like regulatory perspective. As we are talking about the companies from the medical space, medtech and pharmaceutical companies, most of the products are being due to have a certification or registration with a regulator. In Europe, this is EMA, and in the States, it's FDA. And certification of medical and pharmaceutical products is a lengthy process and very costly process. But within the space of certifications, you might have technologies or products that need longer time and longer certification process than the others. So you need to understand what kind of product you are dealing with and what's the potential path for the certification of the product, because that would have obviously a direct influence on a third perspective, which is financial perspective, where you analyze how much money you need to get something in venture capital business called traction. So this traction has, different meanings for different industries. For instance, for internet industry, traction is where you have 1,000 paying customers, and then you can say that I have a business that have traction. That means it helps people online to solve some problems or fulfill their needs. Once in a pharmaceutical business, the traction comes after the first human trials. Your first patients show that your solution, helps, solves problems, saves lives. And to get there, it's a very lengthy and costly journey, through all the stages before that. And you have to be aware of the trip to know at least the map of your journey, to decide whether you can finance a project like this, or how and when you are going to raise capital for the next milestones or stages in your trip. So basically, those three perspectives are pretty the most important. There are obviously other perspectives like infrastructure that you have in terms of machinery and in terms of know-how and talents that are going to execute the strategy and lead the company or lead the project through the stages of its development.
Exactly. So talking to talents, if I may stand up here for a second, let's recall. Maybe you actually remember this day, but just for making a nice metaphor, nice exemplary paint, mental painting, maybe rather painting. Let us all go for a second to this virtual memory of Marek Borzestowski when you met for the first time two ingenious scientists, Tomasz Ciach, Agata Stefanek, their teams at Warsaw Technical University, and they came to you saying, Marek, we have something very significant. We have a solution that can possibly, if the technology and or other certification elements that you have mentioned will be fulfilled, we believe that this is going to be huge. And that was a moment when you have invested into nanovelos and then nanosanguis. And what actually made you believing as much as they have and they are believing in this project, and what was so special in this drug delivery system, for example, and in technologies related to perfusion liquids that can help organs before the transplantation to go, for example, from your city, the beautiful city of Gdańsk, to my city, to Warsaw, without huge damages of the transplant. So what actually made you, I'm still in the era of when you were mainly the investor, not the manager, the board manager of Nano Group, but before Nano Group, what made you believing in that particular set of technologies?
Well, I believe that if there is a great science, then there is an investment. And I think that Professor Ciach is this kind of person that is very talented from the chemical perspective, and he's got brilliant ideas and good overview of the global trends, and how his thinking helps to answer the question how this space where we are dealing with, like oncological drugs, is going to look in 10 years from now. Yes, because when you invent something for today, it's probably already too late, and somebody has or will have something on the market shortly. But if you can envision the direction of development of certain segments, and you design the project for the future that is going to materialize in 2-3 years, you are never sure when it's going to materialize. But if the direction is right and the science is behind, then and the problem that is you're going to save is important, and the market for it is deep enough, then you start to consider the project as a potential investment target. In this specific case, when we started to deal with oncological drugs, that was an elaborated and deeply thought decision based on those factors that I mentioned before. Firstly, we as Nano Group and our product, we design nano delivery systems for active substances. And what it means that we can target specific cells of your body, of the patient's body. In our case, we are targeting cancer cells, and we can deliver to those cells an active substance that's supposed to heal. So we are not discovering a drug again, but we have discovered and designed a nanorobot, chemical nanorobot that delivers the content to the cancer cells, unloads its content, which is an active substance, and gets metabolized and disappears. So we thought that this technology is definitely breakthrough technology because, up till, let's say, 80s, there were no even tries with nanotechnology delivery systems. Now, after 80s, we have this lipid-based nanotechnologies or silver and gold nanoparticles as carriers. But in our very specific example, we had nanoparticles made of sugars. So the innovation was that the nano carrier, the material that we use for building the nano carrier is sugar, which is not toxic and gets easily metabolized. So it's fully biodegradable and does not leave side effects to the patient. So our philosophy was that if we are able to create technology that delivers directly to cancer cells, we would increase the efficacy of such treatment and dramatically decrease the side effects of chemotherapies, because in most of the countries in Europe and worldwide, chemotherapy is used on most of the patients. There are obviously therapies that are not based on chemo, innovative therapies, but usually they are very, very expensive, and most of insurance systems, they don't use it and they don't pay for it. So we thought that there is a need of dramatically increasing efficacy and reducing side effects within the budget that is available for most of insurance companies that cover your treatment once you are oncological patient. So we decided also that the market opportunity is big here, because we provide incremental innovation, give a lot of increase in efficacy and reduction of toxic effect. So we had both factors, and then the third factor, which is financial.
Exactly.
Obviously, in this very case, the whole project in terms of studies that we have to conduct in vitro, in vivo, and in humans, the project is slightly smaller, or it's smaller than if we were designing a completely new particle. So in our case, that was also very important to make that decision. And from the strategic perspective, we were the first, one of the first companies in Poland that decided to go into biotech startups, because from the governmental perspective, this is the segment that it's on the list of, let's say, strategic development directions of national industry. So you can find many programs where you can benefit from different sorts of grants, both national in Poland, like National Center of Research and Development, and international, like from Brussels. So obviously, in this space, we notice that there is more and more funding available from the governmental institutional investors, and this is kind of a very good sign, because all pharmaceutical and medical investors, they are looking for ways to reduce its financing risk related to the project, and institutional support is very often very helpful. In Poland, this specific sector of financing projects is growing year to year. So that gives a possibility to companies like ours to conduct a very expensive studies on this segment. So having that in mind, we see that there are more and more private investors interested in the segment. So the whole system is kind of building up. The system is made of several elements, and private and institutional or governmental investors are one of the most important pillars for the whole segment to grow.
Yes, exactly. And I wanted to touch the base upon the topic of financing of such marvelous solutions, yet very risky solutions, solutions which can materialize in a good scenario, but they can very well also remain in the perpetual process of studying and research for quite a long time. And here is a question to you both, as a president of Nano Group and as an active investor, as an investor with from what I know from this market, and I'm on this market for 10 years already. You are probably one of the 3 names with the highest experience in investing into startups. And the question is, well, imagine a wealthy investor. Let's imagine I have spare 10 million zloty, which is $2.5 million for high-risk investments. I am in 2021, and I already have some symptoms that if I put my ticket to a e-commerce company or telecommunication, startup, or telecommunication startup, or some retail startup, I can already see that there are first unicorns on Polish market, on Central Eastern European market, and I can believe at least that I am participating in a roulette with a with a chance to have a unicorn. In Poland, it's you are probably the first company that went from the stage of startup recently, from the stage of startup to the stage of stock listed, publicly listed company. And there are no, you know, high tech, nano, innovative projects that unicornize themselves. So you have very difficult job to convince me as this exemplary wealthy individual to invest into your startup, which has so many certifications, so many expensive research, as you beautifully explained. So to compete for my ticket of, let's say, $2.5 million, you need to make a thirsty battle with ICT startups. And you also compete as a representative of a sector of very innovative medtech solutions. You compete with the stock exchange, with real estate, with art. It also has its return on investment rate and chances and risks. I'm speaking too long, but my question was really like, how difficult it is to raise another capital for your super risky, yet I know, potentially hegemonic and humongous success, which is healing
first
cancer.
of all, money and return on investment is not necessarily the main driver of humans' decisions. So if you are motivated only with money, you should do probably indifferent things. And the second thing is that in, let's say ICT projects, they are absolutely different from medical projects. I made my first investment in ICT, and what I noticed and found out that programming software investments or building an internet brand, it's very often very much dependent on timing, luck, and the amount of money you put on marketing of this product. If you put enough money on marketing, you can have a medium quality product, but still make money on it. So marketing and advertisement money is very important. There are only a few brands from Poland that make global success without huge marketing budget. Only those companies who were like the first, they got very well indexed with Google search engine. They build their position in the Google search, and those companies online win. All companies that have substantial marketing budget, like Witcher, also Polish product from this segment. But you need to have a lot of luck and a lot of money and good product, but a lot of money for marketing. In life science projects, the structure of the book budget is different. It's not slightly different, it's very much different. 90–80% of your budget goes into the product development, in technological innovation, into research, different studies, and building the prototype. So these are completely different markets. And as I said, if someone believes that there is a good science, and behind this good science there is a good project and good product or good service, the money will be there. And there are investors around the globe who have, different specializations. There are investors who specialize on ICT segments, but there are also investors that specialize on biotech segments. And returns on investments, average returns on those investments in both segments, ICT and medical sector, are impressive and appealing to the investors, but only to those investors who understand the industry. Now, because if you were talking to an investor who is used to internet investments only and he's not interested to learn, then it would be very hard to explain him to invest. But if you are talking to an investor who understands the market, who's got an expertise and can due diligence you, this is different.
Well, sorry, Marek. I thought I interrupted you in the middle of a sentence. Have I?
No.
Okay.
I finished.
Yes. So I'm picking those moments where I believe I can interrupt you with to just go deeper or go a little bit to the opposite side of the equation when you are touching certain points. I have certainly so many questions to you. I'm happy that I at least have this chance to ask you my four main questions. So today I play the role of very, very enthusiastic and enlightened by you journalist. So it's always a pleasure. I always thought I will have this occasion to interview Marek Borzestowski. I am not alone yet. And the promise made to the elite group of participants of today's meeting and the general internet who will benefit from listening to you and other guests later on, once this material will be published on YouTube and in social media. I'm not alone, and I need to share the floor and with other colleagues. I know there are already some questions, and the deal with the organizers was that after certain time spent only together with you, Marek, I will step back and Kasia will run the session of questions from our attendees. So just to sum up the part that I had the privilege to be with you on, I really liked this phrase that if you are only oriented in optimization of your return on investment, you rather don't go to this impactful civilizationally important technologies. You rather go to play with Bitcoin or something like that and speculate. So thank you very much for your mission. First of all, I know it's not an easy one. There are lots of obstacles and problems in this labyrinth of developing new drug delivery system and building a new brand in our pharmaceutical and medtech sector. But first of all, really thank you for your mission and thank you for the time you have allocated for us, for our friends, for startuppers. It's a big deal. We really want to learn out of this experiences. And having said this laudation about you, I am passing the virtual microphone to Kasia, and the floor is yours. Thank you, Marek, very much. I turn myself into the normal attendee and I will listening to your answers from the audience. Cheers.
Thank you.
Hello, thank you, Maciej, for giving me the floor. And okay, I think I will start directly with the questions, and that's are here on the Q&A box for you, Marek. And the first question is, do you have an exit strategy?
That's a very good question. Actually, for biotech companies, I mentioned this traction. You need to have traction to think about the exit strategy. Traction means having first patients. If you start studies of first clinical or second clinical trials, the better. This is a moment where the opportunity window opens, and very often in pharmaceutical business, if we talk about nano delivery, the transaction on the market are based on something which is called partnering agreement, where you find a partner for the further drug development. Further drug development means going through the clinical phase, stage 3, and then marketing the product. And for us, the exit strategy is related with starting the clinical trials. And the clinical trials on the first product, which is cancer, for ovarian cancer, we plan to start next year if there are no other different obstacles. But this is the plan, and this is the time where we could start to think of executing the exit strategy. But basically, this is from the perspective of product development and where you are. So first clinical is a crucial moment in the history of the project. And the second part of the strategy is obviously, what are you selling? Yes. And in our case, very often in biotechnological space, in drug development, you are selling IP, intellectual property, which very often goes down to the patents. So obviously, if you think about exiting, you have to have a technology that has an intellectual property behind that you have the full rights to use. And these elements basically build up your exit strategy. Then you need to define who the potential buyers are on the market, who should or who might be interested in this kind of product. We are dealing with oncological drugs, and we have a platform to deliver different active substances. So in our strategy, we envision possibility of granting rights to use our delivery platform for different manufacturers of different drugs.
Okay, thank you so much, Mark. And there's another question here as well about going public. How did you make that decision?
Well, this is again very good question. Very often the companies go public when the investors want to exit, and there were enough investments from venture capitals or private individual investors, and then the company goes public to provide exit for the investors. And this is very typical in various segments, in various markets. In Poland, we treat capital market as a source of capital to develop the project, to match the fundings that we got from institutional sources. So this decision was made because the Polish market was not as mature in those days in terms of available of private capital from the venture capital that specializes in biotech. So very often biotech companies like Civitta, OncoR&D, and Pure Biologics, they start to raise capital on the public market. And I think it's pretty natural, because investors may invest lower amounts of money, so the financial risk is smaller. You can have more investors. If you are a biotech company and then you want to raise capital, let's say 10 million euros, you have to convince one or two big investors that each of them should put you into your business 5 million euro. And if you don't have those investors on your market, then you can share the risk and look for the investment from on the public market. And then and the investors here, like big financial investors, if you are on the market for a long time, I mean, you are a newcomer, so you have to get your track record and deliver what you promise. And if you deliver what you promise, then you can really think of the second and third round of financing. And this is how it works in Poland today and worked 2 years ago. And well, the responsibility obviously is higher, but if you have a good track record of what you did, then it works.
Thank you for that. And I think we're gonna be finishing with a standard question for today's time, today's environment. So the question about COVID-19 and how does this virus actually influence the landscape and the environment for medical startups? And what do you, with that, I will ask a double question to you. So what are the future trends you think in that context in medtech for, like, let's say 5 or 10 years from now, if you can predict for this amount of time?
Obviously, COVID had different influences on different spaces. On our segment, it had also many different impacts. First of all, we started to think about answering the urgent need, and our company developed protective masks with nano layer that protects the mask from being contaminated with viruses and bacteria. So that was an opportunity for us to introduce new product. That was very interesting experience because that was a product with so-called short commercialization path. So we invented, and after 3 months we had the product on the market. So that was an interesting experience for us. But from our core business on clinical trials of our main product had to be postponed because of logistical problems. But we are back on track in terms of studies. We believe that in the next few years after pandemia of COVID, we will have, at least in Poland, increase of oncological patients, because during COVID times, people were afraid to diagnose. So once they are now starting diagnose themselves, they found out that they have cancer in the 3rd, 4th stage, which is very late. And we have to keep in mind that yearly, cancer is responsible for 20 million deaths globally, over 20 million deaths. COVID is responsible for 3 million deaths up till now, maybe more. So oncology and tumors and cancers and leukemias, this is a real problem for the humanity. COVID only made this problem more evident. So for us, it's a challenge again to provide a solution for for this illness. And well, I think that we have to adjust our systems to living with COVID. It is going to probably stay with us for another couple of years. Hopefully it was not going to be a system-breaking virus, because in the numbers it's not very impressive, but if it spread and went out of control, that could have been a really disaster. And we see how fragile our systems of defending health of humanities are, and we see that there is a lot to work to in the future to avoid such situations like we had for the last 2 years. And obviously it will make investors more eager to invest in biotech space, and we've already seen that for the last couple months, and we see that this market is accelerating. So from our perspective, coming years we see as a challenge, and we think of a further development of our company, both from the product perspective, and financial perspective.
Okay, Marku, thank you so much for being here with us today, for sharing your precious time and the knowledge. It's been very interesting, really, truly. And I hope you had a nice time as well with us for this hour and with Maciej. And I hope to see you again soon.
Great, thank you. Look, thank you for having me. Thank you all the attendees for sharing their time with us. And I hope that I could give you my perspective on the segment, and wish you all healthy end of this weekend.
Yeah,
Bye.
thank you. Thank you so much. Okay, so now we will smoothly move on to narration. Today you have a chance to hear from different people, from people experienced with working with bigger corporations, and from startups who has already been for some time on their journey. And one of that startup is Naviration. We met with Naviration when they came to our acceleration program called Warsaw Booster last year, and they won the whole path, the whole event. And well, I don't know if I should tell you more about what Naviration is actually in charge of. I think maybe the co-owners of Naviration will do that better themselves. So it's very, I'm very pleased to welcome Mikołaj and Paweł on stage. Hello, guys.
Hello. Hello, Kasia. Welcome, everybody. Nice to see you and welcome you.
Nice to hear you.
That's right. So maybe a few words about our company.
About us, first of all.
Paweł, maybe you start.
Okay, well, my name is Paweł Kukołowicz. I'm professor in medical physics, working at the National Cancer Institute in Warsaw. I was graduated from physics at University of Warsaw, and Mikołaj is also a physicist. Mikołaj is graduated from the University of Technology in Warsaw. We met each other 3 years ago, roughly, In my department. In my department means I'm the head of medical physics department at the National Cancer Institute. And well, we understood that we could do something interesting for radiotherapy. However, the whole story, the whole history started many years ago when I participated in the conference. And there I met the group of engineers from the company called OptiNav, who presented at that conference the optical system. The optical system who was and is able to measure with very high precision of the position of the marker. The marker is just cycle. They measure the position of that cycle and then can say what is, well, the distance between 2 points. The system looked very simple, 2 optical cameras and a marker only. As I mentioned, the precision was very high. That system I saw that time, the precision was about 2/10 of millimeter, but we know that it's possible with that system to have even much more precise measurements. That time I had a long experience in radiotherapy because, well, maybe it's not sound very well, but I started 1980 where there was no linear accelerator in Poland. There was one, the first linear accelerator in Poland. And well, for many years, I was involved in treatment of patients with radiotherapy. Before we were informed about nanoparticles for treatment of cancer, radiation is another method of treatment of patients. At about more than 50% of patients are treated with ionizing radiation. What is the most important for radiotherapy? It's precision. Precision is the key point for radiotherapy. And we can talk about 2 types of precision in space of dose and in space of position. And that might be a little bit surprising, but positioning is even more important than dose, because if you make a mistake in positioning of the patients, you just may even kill a patient, and of course you cannot treat him or her. Radiotherapy is like shooting at the target, but with very important anatomy structures, which are very often very close to the target. For example, optical nerves, or I don't know what might be spinal cord, any other type of anatomy structures.
Yes, to fulfill this story about treating people with radiotherapy, it's worth to mention the path is done with the path the patient follow before the radiotherapy starts. After the cancer is found in the body, we need to see where it is. So we use several imaging techniques like computer tomography or magnetic resonance, which allow us to define where exactly the cancer, the tumor is placed. Then we have to program the therapy to decide which radiation will hit which place, just roughly speaking. And finally, we need to verify if the plan is prepared correctly. And finally, the patient go through the several partial fractions of radiation, receive it, and everything is a chain. This path is like a chain, and the success of therapy is just stays in the accuracy of correctness of each part of this chain. And you can see here, you can hear, you can know maybe that physicists are crucial in medicine. The physicists are the people who join the nature, the technology with the medicine. So thanks to physicists, we can use instrumentation, new instrumentation in treating people like USG, RTG, CT, MR. The nuclear medicine and radiotherapy is one of the aspects of using physics in medicine. And we both are physicists.
Yes, and Mikołaj said that physicists are very important for radiotherapy. I want to emphasize that our institute is memorial, Maria Skłodowska-Curie Institute, so it's devoted to Nobel Prize winner, the Polish physicist and the French physicist Iver, and she was the founder, let's say, of our institute. So coming back to that conference, because that conference started everything. When I was presented with this system, I understood that that system can be used for radiotherapy. And it can be very easy use for radiotherapy. So I came back to Optinaf and I said, well, we should do something for our patients. You know, I really want to treat our patients as best as possible. You should help me. And we started to make the first system. And the first system was devoted to positioning of our patients. But the entire project was carried out very slowly. Why? Because there was no enough money for it. And we just wanted to share with you some such hints we think are the most important for any project which, well, in any field. So the first hint is to make a business, you need to have insured financing. Might be it's obvious, but for that time, to be honest, I didn't understand that well, that everything went so slowly because there was no enough money and we go step by step. Eventually we build the system and the system is used in our hospital for our patients. I'm very happy with that. And later on I understood that that system can be used also for other purposes. But well, about that I will.
Just to make clear, we have two kinds of precision. First precision, we need to ensure that patient stays in correct position, because you always put radiation in one point and you need to ensure that patient is exactly at this position as he or she should be. But second precision, you need to ensure is that precision of apparatus, of this instrumentation. So if anything rotates, you need to ensure that rotate correctly. So if the radiation is emitted, this radiation go to the correct place. So you have two types of precision you need to ensure. So first precision, Paweł was speaking, was to ensure of the position of the patient.
And you should remember, you should realize that the gantry of accelerator is about 10 tons. So of course, positioning is not very simple. We know that modern accelerators are very good in precision positioning, but anyway, there are some deviations from the ideal situation. So coming back to the story, well, we had not enough money to, first of all, to promote the system, and no manpower. And well, so we stopped for some time. The system was implemented in my hospital, but well, it was not developed any longer. Also because the company Optinaf was acquired by Zeiss, and Zeiss told, well, we are not interested in radiotherapy, please close that project. We are interested in other fields and other projects. And then I met Mikołaj. Mikołaj came to my institute and started to be one of the members of the dosimetry system. And he started to make quality control of accelerators. When he started to make quality control of accelerators, he understood that it's very, let's say, boring, very long, and very difficult to make quality control with the instrumentation, with the tools we had. When I presented to him the optical system, immediately he understood that that's that solution. We can use that for making completely new, unknown system for precise measurements of positioning of accelerator. And then we started. But coming back to the next thing, well, I'd like to come back to Zai's story, to acquiring the company. We always should make risk analysis, and even very unlikely scenarios have to be considered. I was, very, very involved in the project, and I thought everybody should be so happy with that. Everybody will finance it, will follow my ideas, but that was not true. Just company came and said, our aims are different, you should close the project. So we started to think about our project.
And this was a great chance for us. Actually, as soon we know that the company which was doing this topic at radiotherapy, and the company which don't want to do it anymore, we found our place to continue this work in better way and in considering other path of using this in radiotherapy. So as I mentioned it before, we have two kinds of precision of placement of patient and the precision of all instrumentation. And as Paweł said, I was doing in daily basis measurement of accelerators if they rotate correctly. If you imagine 10 tons rotate, and you have to ensure that the difference between position at each angle are less than part of millimeter. The best result would to know 1/10 of millimeter, but the instrumentation we use, we could say only it's below 2 millimeters.
Just one remark to that. Please remember, right now radiotherapy has changed very much, because right now we, for example, treat 5, 6, even 10 small lesions, small targets in the brain, and we have to hit in the same time these 10 targets. So the precision is really very, very important. Okay, but I'm not engineer. I'm medical physicist. I was involved in treatment of patients, and I was very lucky that I met Mikołaj because he was engineer. He looked at the whole proposal from engineer's point of view. And here is the next thing. We think it's very important. You have also to be lucky, the right man and the right time. If I didn't meet Mikołaj, I wouldn't be able to come back to our projects. So we started. And we were looked for how to make it. It was not easy because both of us, we had no experience with business. So we were look how to make it. And then we met many other very, very clever and very helpful people. Some of these people are here with us or were with us. I don't know. Sadowski, sorry, I don't remember. Marek Sadowski. Maciej Sadowski is still Maciej Sadowski is still with us, but not only him, but we had to learn how to make business.
Yeah, the whole story is very surprising for us, as we know that first thing is to know good people on the right place, and you need to know professionals who help you. And on the very beginning, I think there are, for everyone, plenty of problems and very, very little solutions. So the major problem, you don't have money, you don't have time, and you want to start new projects. So I learned a few things, how to finalize project without money. So this sounds very difficult, and I think probably some of you also have very similar problem. First thing I learned is to meet the right person who is the professionalist, who is interested in the topic. So the person you can trust. And before you start anything, if you cannot find a person who is on the right position at institution, at medical institution, it means maybe your topic is not enough interesting. So first, it's good to have on board the person who really know the topic and who say, yes, I want to give my time for this project. So these two things. First, you can be sure that you don't lose your time, that this project have really sense. And second thing is that the person who will do it with you, it will be kind of professor, or it will be the person who is well known in the world or in your country at this topic. His surname, his name, ensure that your topic have sense. Even somebody don't know your topic, but because the person is with you, you can say, oh, yes, maybe this topic is worth looking at. So before you start, you need to have very trusted person you can lay on, and you can do all next things.
Well, but Mikołaj told that it's very good to have the professor in the group, but I want to say that it's not the most important point. And we will very quickly learn that at least me, that please don't think about what you want to do in the way as of a research project. It's not a research project. Research is only part of that project. Please remember, research don't be professor only. You should look for business solutions. And today it's very clear for me. So if there are some professors here, please remember about that it's professor's attitude to the problem is not the right one.
But as soon you can have a second person, expert, who you can rely on, you need to create a team for two reasons. One is obvious, you want to create a project and you really need a specialist to do the work, but you don't have money to pay them. So first of all, you need people who will advise you, the people who will tell you what is good, what is wrong. And you have friends, you have family who can at least give her surname face to show, to present with you the topic and to advise you in the topic he know well. For sure, I cannot do everything. I need to rely on the people I trust. So when we were starting, it was September 2019, I asked my friends if they could help us. I was not a good programmer, so I asked my friend who is very good in programming, can you help us? He said, I have no time, but I can tell you whatever you need, what's your questions. I can advise you that you can choose the correct solution for your problems. And this was really enough to keep us going. Second friend said that he have time and he give us lots of work without asking any money, because he trusts us. I never promised him any money. He just know that when money will be, he will be paid, and he didn't ask ever for any money. So these are the people you can rely, your friends, your family. So we ask also my friend, the brother of my wife, he also helped us however he could. And this was enough for beginning to start talking with other people, other groups, that we are a team. We have people to finalize our project and keep looking for the money. But before we have money, you need also to have some business plan. You have to have all research of market research. So you can find also many people who work for success fee. So the people who don't ask you for money now, but you sign the contract with them, as soon as you success, you will join with them your success. And I think everybody is happy because we don't have money, but we hope we will have it. And there are some people who look for such a project. We were lucky to meet such a people because our business was actually based on the few people, on the one man who tell us, do this, don't do this, ask them, don't ask them. And we found ourselves to where to go. And also, if you want, you can find new friends, new people who will help you without asking any money, just because they find your topic is interesting. Especially if you work for medicine, if your project is for medicine, or like us for oncology, we really want to make better world, and you can find many people who will support you without asking for money. Just try asking new people you don't know, but you want ask them for help, for some advice. Very many people will help you without asking the money. Just one barrier, one problem is our imagination. Very often we are afraid to ask. We need to ask. There are really very many people who don't want money for help. They just want your project keep going. And we were very lucky to meet many people like this. And we are very happy. We are really grateful for them. And we know they never ask us for money. But also there are some symbiosis of success. Some scientific institutions, universities are happy to work with new startups because they need to fulfill the points that they have from ministry. So they have national financing, and they need to fulfill some,
it's called evaluation,
that they have some success stories. So they have some startups, so they have some new developments, some commercialist things. So they show they don't do only science, they have also some success in business. So you can ask at every institution. For example, at university, there is University Centre for Technology Transfer. At SGGW, this is the another university in Poland.
Agriculture University.
There is a Center for Innovation and Technology Transfer. University of Technology got Innovation Management Center and Technology Transfer. So if you write in Google, Technology Transfer University, Poland, Warsaw, Krakow, you will find many institutions which are ready to help, are really looking for such a topics to help it, and it doesn't have to be medical university. Very often it can be technical. For example, we were using help of agriculture university, which is brilliant for us because we were very keeping forward thanks to this help. And finally, the organization, foundation, you can know from now actually the Startup Hub Poland, the Fundacja Most with Akademicka Liga Startupów, and also some national programs like Polska Wschodnia. You can find very many people and organizations who give their time and experience just to help, and very often for the minimis basis. So the European Union funds, which they pay some money for the experts to help people like we are. So we met Maciej Sadowski with Kasia Skoneczna, we met Janek Kaczmarek with Barbara Domaracka, the people who really put our business on the very well foundation we see this way.
And I think that I should emphasize that we are very lucky with that, because it's not very easy to find the right advisors, and we have to look for them in every field of our business, and well, also in science. We have to listen to them and listen carefully. And we can tell you that might be we met about 15 people, and only 2 or 3 we just we didn't want to cooperate with them. All other people really helped us. Might be we were very, very lucky, but we wish you also such lucky situation as we had. And what is important, I think that create a startup in Poland, you must have help in Poland. We don't believe in success without help. The situation in every country is a little bit different. It's similar, but also very much different. And you have to follow the advice of people who are immersed in the market of that country. And we did it. And the next part of our talk is about the speaking. How important it is to present yourself. I didn't understand that because as a professor, I really gave many lectures. But the people from business field told me, well, but your presentation should be different. Remember, it's not research, it's business. Of course, research is important, but please remember that your aim to convince people who are immersed in business. So I started to learn how to speak from the scratch. And again, we had a lot of help from other people, especially, for example, from Maciej Sadowski. He was really our advisor, how to prepare presentations. And it's not my opinion, it's Mikołaj's opinion that the speaking is the most important point in business. If you can speak very well, it's very likely that you, even if your project is not the best one, you convince people to support you. And we really succeeded in speaking because we participated the competition called Warsaw Booster. It was two-stage competition. And to our surprise, we went to the second part. So there was 10 the best startups. The best means chosen as the best one. And in the next part of our presentation, we just won that competition. We were really very surprised. It was something unbelievable for us that we could be the best startup in Warsaw. But to be honest, we really spent a lot of hours of preparation of that presentation. We changed it, we created professional studio to present ourselves. And that is thanks to Mikołaj.
And also we progressed our project during this competition because we used the opportunity we have from it. So there is always at every competition some preparation, and the panel of experts, you can use their experience. And it's really worth, even you don't win the first place, it's always worth joining such a concourse that you can get new knowledge. And first of all, I think also is that you meet people with new experience, and the people who very often can help even beside the competition. So we found that there are many programs for also medicine, but not only, just for startups, that you can participate without money, and you can meet the best people, the experts who can advise you, and you know them, and you can meet them many times again later on. And if you have a problem when you start your company, you can always go back to them and ask. We know we can, for example, go to Maciej Sadowski, and whatever problem will be, I know he will help us as much as he can. So I would never know him if we don't try to start in such a concourse, in such a programs for startups. So we have many thanks to many people, and we wish to help anyhow to the others, just because many people help us. So we are ready, we are happy to help others as long we can.
Well, many times we repeat that the people are very important. We can even say that the most important, probably in each project, in each activity of human being activity. And the next step when we decided to follow that project was to build the team, And that was not easy, also because to build the team, you have to promise people money for their work. But luckily, it was the time when the private businessman came to us. He was found by man from University of Agriculture. He was interested in our project, and when he was informed, presented with our project, he said, yes, that's what I'm interested in, that I'm able to invest 1 million Polish zloty. And when we had that money, we said, okay, we can start. We can start because then we can say the people they were found before. One, for example, of these people was my student. He made Master of Science under my supervision. We can say him, okay, you can join our team and we have money for you. He was a programmer, very good programmer. And as you probably imagine, that programmers earn a lot of money in Poland, so much larger money that we earn. So we had to have that money, and we we have them. So we started. So we have programmer. Now we have to find some engineers. We found a man who is very good in cameras. He's not part of our team, but he helped us also a lot. So the building the team is also very, very important. And please don't be, well, how to say that correctly in English? Sometimes you have to say somebody, no, sorry, but you don't fit to our team, because that's a very important point, to have the good team. You trust the people, and I think we build such a team.
To conclude, our story in few words is that we opened our company in June 2020, and before 12 months, at May 2021, we got financing from private investor. So we are very happy, and we say this is kind of success story, but this is just the beginning of the story. We're still waiting for funds from PARP, the program, Polish program for financing. And we will be a success when we have a product and when we sell it in rational amounts of pieces.
Polish
anyway,
Agency of Development of Business.
Anyway, yes. So just to say thank you for attention. I hope maybe you have some questions that we could answer, and I hope we could help you anyhow. Just let us know.
Yeah, you're almost free to go, guys. But before I let you and then let all of us take some kind of break, a short break for today, I have some questions. And the first one I was thinking about, what do you guys think is the biggest challenge? What was surprising to you, and what you felt like a big challenge? And I think especially foreigners could feel the same way about it in Poland while starting out, like maybe some experience from the legal point of view. Maybe what was the main issue for you?
I see two actually things which were most difficult. First is the bureaucracy. Every year, every time, every point is giving more and more bureaucracy. So if you plan if you schedule some tasks, you always need to multiply by 2, by 3, because you have many of bureaucracy things to be done. If you apply for money, if you ask investors to share with you their money, you always need to be prepared. So first you need to have a product, the idea, the product, and lots of paperwork.
No, sorry, I interrupt you with bureaucracy, but the bureaucracy is really terrible. But the problem is that you cannot deal with the bureaucracy yourself. You have to have help from, for example, lawyers. If you don't have such a help, you cannot, well, break bureaucracy. It's really enormous, difficult, and, well, it takes time.
Yes, so this is the first thing, and second is to find the correct people. The people are always difficult to find, but I always say the first thing are the people and the trust. I cannot work with people I cannot trust, and this is the very difficult, but this means that sometimes we need to say goodbye with somebody, and as soon as you say goodbye to the person you cannot trust or you cannot work with, as soon you will find the correct person. So this is a difficult, and maybe third thing is to work without money. So I guess most of us know this problem. You need to work without money.
And the fourth one, which was for me the most difficult point was to understand what is the difference between business and research. All my life, I was researcher. And I was convinced by many people, please remember, it's not research, it's business, it's business, it's business. And I had to learn that. I had to learn and understand that the rules are different. The rules are different, the presentation should be different, well, the thinking about the project should be different. Might be you have beautiful, brilliant idea, but it's not. It won't be able to commercialize it and so on. That was, and I think that's also in front of us, because one thing is to build the system. We are very close to build it. We used our prototype for measurements. We know how our accelerators behave, but another thing is to commercialize, to sell it. So that's in front of us, and I hope that will be very difficult.
Yeah, and about that, I'm thinking, I know you're not quite there yet, but however, you already have some experiences, so maybe you'll be able to tell us more about it, or develop what your thoughts about that particular problem issue are. And here I go with a question. How do you think, what do you think is the best option for medical startups and from the healthcare area to attract clients in Poland?
Very difficult question, because the topic is very wide. This is the question that every time will be different for each project. Actually, I think that there is always up to the end the question: will anybody buy this solution? Will we have enough clients to survive? And there is no other way, in my opinion, than going step by step, checking if the idea is correct. So, as I mentioned at first, good thing is to find the person who is a specialist at this topic, to ask what he think about this topic, and then to do the real research, to ask people. So before you invest money and your time, to have good research if anybody is interested at this solution.
Yes, and well, for us, the project was not only the business project, it was also the mission. We wanted to treat our patients with very high precision. And that helped us a lot, because when we met other people, they understood that. You know, everybody of us has at least somebody in our family who suffered from cancer. So the people understand what is cancer, what is oncology, and they very quickly were engaged in our project. They say, okay, we want to help you. We want to help you. It's important. So, of course, from our side, it was our mission. We said, okay, we do that project even if we don't earn a lot of money. Of course, we want to earn a lot of money, but the mission is to prepare the first product, because then we will be able to precisely measure our accelerators. We have even 9 accelerators in 2 branches of our hospital. So all of them will be very well controlled, and we will be able to treat our patients with unusual precision.
Better precision, yeah. So I think you need to try. You need to have a guess with all things you have in your head, with all ideas. We have another few ideas we want to do, but we stop it before we finalize this one. So this was our guess that this will be the first thing. And the great thing was when I was meeting the people, and I saw in their eyes the fire, that they are interested in this topic even more than I am, maybe. So this gave us a power, because it seems that not only we thinking that this is important. So if you speak with the people and you see the fire in their eyes, that they are also interested, that this sounds good, then keep going, but keep asking, keep checking if you're really on the correct way. I hope we are on the correct way. We always asking everyone if maybe we doing something wrong, if they could say us their opinion, maybe we should do something differently. But first you need to try and ask everybody.
Okay, I really liked the part about stressing the importance of what you guys doing, what you guys selling, and attracting people, engaging there actually in your story. I think that's a powerful move, and then this is something very important, and actually I think quite easy to do, to engage people from the perspective of a healthcare startup in general. So this is this hidden power that you always have while talking to the investor, and probably while targeting clients as well. But we're coming to the end, but I still have like our standard questions at the very end for you, and those are, what do you think, in what ways COVID-19 has changed the market and the way medtech startups work on the market, on the Polish market? How does this affect Polish market and the startup ecosystem?
First of all, we had to take into risk that every one of us has just one life, and everyone can live this life very quickly without saying before. So we had to plan our work that we can continue even any one of us is missing. But if you ask for market, in Poland, actually, this is a sad story, but we see that oncology is even more needed. And in oncology, actually nothing changed. It is still the most problematic disease for human being. 1 person at every 5 persons will have cancer statistically during their life. So, in my opinion, we see the COVID-19 gives some problems, but didn't change much in strategy.
I think that it haven't influenced so much COVID on our field. Why? Because, well, cancer is not linked to COVID itself, and we all the time we have patients. All the time the problem was very, very, very important for the society. And in Poland, at least in Poland, the money which are spent on oncology was not less as before. However, you know, that's in front of us because we will be ready with our product in a year. So,
yeah, but then, you know, what the previous our previous expert said about the amount of illnesses going forward after the COVID, because during the COVID people were not able or didn't want to diagnose. So, and now you're gonna face probably some larger number of patients coming to you. So you know, maybe for you it's where everyone else is losing, maybe for you it's the place to gain. What do you think about the future, and what are your predictions?
Is to buy some products. That's we see that it's, you know, it goes slower, and when we want to build our product, we know that it's not easy to find them. So from that point of view, COVID really destroyed the market and make that part of the work more difficult.
Okay, so do you guys want to add something at the very end? No?
Yeah, actually,
Yeah, I've seen something, you know, that there's still something in your eyes.
yes, I just next year we plan to start selling our products. We trust in God everything goes well, and we hope it will. And if we succeed, we will always be grateful for everyone who helped us, like Kasia Skoneczna, like Maciej Sadowski. And we know that there is lots of startups, and it's difficult to get any financing, and it's difficult. But I think this is the part of the game. If we can keep going without money, then everybody see that we really believe in this project. So it's easier to finance people who really trust and believe in their project. So even it's difficult, I wish everyone success, and I hope we will be also the success company.
I'm just happy that we met each other and that the project was found in the right time, and I'm happy that we are doing that. It's my pleasure that as a professor doing some research, I'm also able to make business, so which is surprising for me.
Yeah, this is the way big ideas, great ideas are born. So, and there's nothing new here. Thank you. We're very grateful for your time and for your presentation. Thank you for your voice, and I hope to see you soon.
Thank you very much for all you.
Thank you.
Okay, and now we're a little bit ahead of schedule, about 8 minutes. So I suggest we could just take a break, make yourself a cup of coffee or a cup of tea, and at 3:20, we can see each other again with Mikołaj on the stage, Mikołaj on the floor. How does that sound? Mikołaj, what do you think? You're here. You're with us.
Yes, I'm here. I didn't want to disturb, but I just sent a private message to Paweł Kukołowicz. I think we haven't seen each other for many years. So, and this is not connected to innovation, healthcare, business, or science. So, Paweł, very happy to see you and greetings to your family. Yeah, I'm ready. So we can start 20 past. We can start earlier. So I know if people have any, let's say, attendees have any preferences, I'm happy to start whatever you want. So
yeah, okay. So let's take a short break, and we'll see each other at 3:20.
Okay.
Okay.
Super.
Great.
Yep.
Thank you.
Okay. See you.
Hello, everyone. I guess I should say welcome back after the break. Depending on, okay, I see Mikołaj, he's here with us. So, Mikołaj, I think I will not take your time, and the floor is yours. Okay.
Okay, super. Kasia, thank you very much. I saw that previous presenters were rather trying to speak, not using the slides. So I hope that your guys over there, I know it's, I mean, I can imagine that sitting in front of, let's say, black window or just guy talking is difficult. So I will try to simply just do the best I can to tell you a little bit more about, let's say, my experience, how to work with the big pharma in a context of let's say Polish market. So I hope can you see it in a full screen mode or in a presenter mode? Kasia, can you confirm?
Yes, I can see everything very clear.
Okay, super. So yeah, I have a couple of slides, but obviously I was super open to, you know, get some questions or comments or even get into some discussion. So yeah, as I was asked to speak about the partnering with big pharma and whether that's a recipe for success, and give some tips for startups. As I understand, this is a majority of our audience today. But before I will go to that, I will give you some information about the organization I work for, the way we simply do the innovation, and how we stimulate the access for startups to pharma. So I think that might be quite interesting for those of you who have never heard about EIT Health. But then I will also try to be more specific on my experiences working with startups, innovators, and let's say basically how to build your project to be more competitive and interesting for the startups. So let us start, let's say, with giving my motivation for being here. So from education, I'm a sociologist, but for more than 10 years, I'm engaged with medical and healthcare innovation. So on the daily basis, I work with the startups, with research and clinical teams, mainly in Poland, but I have also I had interactions in the past with companies, let's say, around the Europe, because the EIT Health is a pan-European organization. So I mainly advise on a business development and a strategy and innovation. So every year, let's say, I had a privilege to work with around 50 projects coming from, let's say, different disciplines, conditions, technologies. So mainly from medtech, biotech, and digital health. I just want to say that I'm not working with a pure drug discovery projects, although I have some experiences, because that's not a focus of EIT Health when it comes to let's say scope of what we're doing. Yeah, and what I really want to, let's say, underline in the beginning of this presentation and my speech is that, let's say, I really believe that you can only build innovation project that will be attractive for anybody if you're ambitious enough, you have a good understanding not only of the technology, but also about unmet clinical needs. So basically, if you're able to build a feasible business model that is able to really, let's say, inflate the solution and bring it to the market. So I will try to address that points in a few minutes. So a few words about the EIT Health. So we're largest public-private partnership in Europe with more than 150 organizations across Europe. So we operate in more than 20 countries. We have businesses, corporates, we have universities, research institutes, providers from health sector, regulators, clusters, and accelerators. We also work closely with the patient organizations, and we try to call ourselves an incubator for healthcare innovation. So we simply try to build up a friendly environment for the ones who are trying to solve the largest challenges of healthcare in Europe. And what these challenges are, which I think for majority of you are obvious, and they are also, let's say, reflecting the Polish market, is strengthening the healthcare systems in Europe. So we are trying to build up let's say, feasible business models in which healthcare can be more sustainable, not in terms of only in terms of financial KPIs, but also in terms of quality of the care provided to the patients. We also try to encourage patients to just take care about their health by using different technologies on different levels. Last but not least, this all contributes to the sustainable health economy. So we run also education portfolio. We take care about bringing relevant competences to the market linked to the healthcare innovation, and we also boost economy through accelerating companies and let's say building the most effective pathway for those who are trying to address the unmet clinical needs. And yep. I will be trying to mix a little bit the information on, let's say, our achievements and concrete case studies with some thoughts that I think might be useful for those of you who are running startups and you're struggling basically how to enter this system, or maybe when you are in the system or ecosystem, you're trying to find the best way in getting to the relevant stakeholders. We're speaking about let's say big pharma companies, which I understand for, let's say, medtech or biotech or pharma startups is one of the major targets. So I try to summarize here the way we work. So as you can see, we really try to look at the strong identification on unmet clinical and economic needs. And this is something that is really, let's say, a pattern. So we do not invest at all in the projects that are not going through that step. So in order to initiate innovation project with anybody, but especially in that conjunction of commercial partner and the provider, you have to understand unmet clinical need. I will return to that later. And then you're able to initiate the innovation or project that is supposed to change or optimize, for instance, a patient pathway. And then you're able to scale and address this need based on a project or new venture, and you can deliver it to the patient. So in the end, to the market, so you can start generating the sales. And this is how we basically do it. So on the right side of the slide, basically we're touching, providers, we're speaking to payers. So we are trying really to help the teams or the projects that are asking us for support, not only to provide money, but really to provide access to knowledge and relevant people that can solve this. And I will try to also address in details what do we mean by good project that is attractive for investors or is attractive for big pharma. So these are the numbers that, let's say, I collected for 2022 for you. So we are still in 2021, and let's say probably for all the organizations dealing with health, 2020, 2021 are still, let's say, quite difficult periods due to the COVID, but actually we have to really find the different models of reaching to, for instance, to healthcare providers. So for many months, at least our innovators were not able to work effectively with the hospitals because they were simply overbooked with the COVID patients. But this is what you can do. So the portfolio of EIT Health is diverse. So this is not only, let's say, innovation or R&D projects that are focused to deploy something into the market. We also have acceleration programs where we support companies on a different stage of development. I'm not going to address this item today too much because that's not a topic of my speech today. But if you're interested in gaining more knowledge, what my startup can benefit from working with EIT Health, I'm happy to do it either today or you can find my email and phone number in the end of the presentation, so you can reach out to me easily. And we also have our education portfolio, which means that, as I said before, we try to address citizens, patients, students, medical staff, so everybody that is in a value chain of healthcare that needs certain piece of knowledge to simply deploy the innovation faster. And a couple of numbers, basically, which I think quite good to showcase that we're really impacting the market by raising funds by the startups we have been supporting, or jobs that we have created, or products that have been introduced by our partners or startups that we work with across Europe. And let's say, I think first, let's say practical glimpse on how you can work better with pharma is actually one of our programs that we're successfully bringing up since 2019. The program is called Startups Meets Pharma. I also embedded the link to this program. So if you're interested and you want to apply or you want to learn more basically how the program works, then I strongly encourage you to use the link. But I would just maybe shortly stop here just to address maybe the first, let's say, chapter on how whether working with big pharma for startup is really a recipe for success. And here I would say it really depends. Because at least in this program, what we simply have done is we have around, 15 to 20 largest pharma companies that have their R&D and operations in Europe. We simply just, instead of only engaging those companies in elevating their portfolio of products, for instance, increasing the compliance for the patients next to the drug therapy, whether they will be interested to have a better insight to the startup market. So obviously they have their innovation or open innovation centers, they have their scouts. Many of these corporates in the big pharma sector, they have their dedicated, let's say, VC, let's say, wings. But we understood that basically what is really attractive for those companies is when they can be introduced to the startups that are able to address concrete challenge. And this is the way we have built this program. So you can see on the left side, basically what big pharma can benefit from this program. So we simply ask big pharma companies such as, Amgen or Sanofi or Bayer to bring certain challenges. They might either address a technological challenge, business challenge, or a specific condition. So every year we bring, let's say, different companies, let's say, sponsoring on owning concrete challenge. And then we as EIT Health, we try to dig into the market of startups and bring the startups which are really fitting to these challenges. And obviously then you have all that interaction, which is, pitching, one-to-one sessions. And after this, let's say, pre-selected group of startups normally is having, let's say, a successful relationship being built with the big pharma. So I think if as I said, if you're a startupper, if you have your company and at the certain point of your business strategy, you're planning either partnering with big pharma, or maybe for you the major, let's say, development pathway is going to be acquisition. Or if you're simply trying to, let's say, have certain market access capabilities through collaboration with the pharma, probably you should forget about, just trying to schedule a meeting. Try to look at the companies who, on one hand, are openly sharing their challenges. So they're kind of opening a bit their internal environment on certain struggles, but I wouldn't call it a struggle. I think they're just opening a certain collaboration opportunities. This is a right address. So this is where I will be also trying to design or look at the solutions that you're working on. If this is really the pathway for you, as I said, it really depends. It doesn't have to be, or it's not the only parameter or indicator that would ensure your success. So that's one thing. I think that also a nice pathway is that not always going directly to the big pharma is the case. We have a very, let's say, similar program where which is called Startups Meet Healthcare Providers. I am also not going to address it, but please note that if your project is really not well validated clinically, it's not going to be recognized as an interesting one for the big pharma. So I'm going to address all these in some kind of wrap-up thoughts I put together for you for today. But this is, I think, one of the ways that you can engage with the big pharma. This format is working quite well. And there has to be always an enabler. And we as EIT Health, we play the role of enabler between big pharma and the startups on a specific ground of challenges. Maybe one example, because let's say I was asked to speak a little bit about, let's say, introduction to the Polish ecosystem. So this is one of the startups, Polish startups, biotech startups that went through the journey with us. So the startup is called Uvera, and I have a really large privilege to sit with the company in one building, even in one floor. So we have, let's say, almost a daily interactions, and let's say we met each other in 2019, and the team joined one of our boot camps. Then they went through our acceleration programs, they received awards, and they have been also our finalists for our, let's say, the most prime program in terms of exposure to investors, called European Health Catapult. And in 2020, they got the first prize in a biotech category, and they have been featured on a NASDAQ on the NASDAQ, let's say, screen on the Times Square. So basically, the company used our network, access to finance, access to knowledge to simply boost their company. They're also one of the very few grantees from EIC. So I think this is, let's say, one of many of success stories in which, let's say, accessing the ecosystem in a relevant way really helps you to boost the business. So actually, at the moment, Uvera is, let's say, not working directly with any big pharma, but I know that, let's say, an element of their strategy is actually to engage at a certain point with large companies in a fragrance and cosmetic industry, because obviously the substance they're producing and the, let's say, ingredient to skin protection cosmetics would have to somehow be one of the elements of the strategy to work with the large companies, and we hope that, let's say, EIT Health might be for them one of the windows of the opportunity. Although that I know that the company is, super focused, they have fantastic competencies inside, and they definitely know how to build the business. So just a short, I would say, flashback to some success stories, and this one has been generated, and it's happening actually in Poland. They have some other sites where they do R&D activities, but major operations are in Poland, and I'm very happy we had a chance to work with them, or we continue. A couple of words on let's say, the place where I work. So sorry for jumping here and there, but I hope it will not, simply, I mean, that you're still there and you're not falling asleep. So I just want to just focus a bit on this part of Europe, which is very particular. In EIT Health, we name it InnoStars. So we gathered the best top organizations in Portugal, Poland, Hungary, and Italy to work together to build a stable and, let's say, developing competencies, capabilities for innovation regions in that part of Europe. We also have engaged with institutions that are beyond the place where EIT Health is present. So you can see also these smaller, let's say, dots on the map, which we call them hubs. So these are, let's say, external institutions such as universities, clusters, hubs, accelerators that work with us. We managed to in this part of Europe only to boost a number of startups. So every year it's roughly 40 startups, and they're really, let's say, successful in our journey. And and we also have number of education programs from very early stage, let's say, which is targeting very early stage research projects to very mature startups, including scale-ups. Our partners, so we really cover, and this is just, I would say 1/7 of the entire EIT Health, let's say, partnership portfolio. So you can see here different organizations, as I said, hospitals, companies, but also universities and research institutes. So I'm just showing this for you to really understand in let's say, where do we operate and with whom we engage, and also a couple of startups that we have been working. So they're not only from Poland. So I have been, let's say, mentioning Uvera, but we also have companies from Lithuania, Portugal, from Czech Republic, Hungary. So different technologies, different approaches. As I said, we do not work with the companies working on a medical, on a drug, on new drugs, because for us it's too long when it comes to let's say, period of time where we are, let's say, able to finance the project. So for us, it's a maximum 3 years. So we simply are not able to meet the expectations of those companies. I mean, normally, that this process would take you 10 years and much higher amounts that we are able to provide in our grants or equity-based instruments. So as you can see here, by the names, we have companies that work in the biotech, diagnostics. We have companies that are broadly using artificial intelligence for both diagnostics and treatment processes. We have companies in the field of radiology, so education, but also, let's say, early detection, stents, so also medical devices. So number of, let's say, different, let's say, specialities. And as I said, our major focus is on biotech, medtech, and digital health, which simply, on one hand, narrows down the portfolio, but I believe that we're really, let's say, addressing a niche. So and also the trend in a medicine and healthcare innovation market. So now, at least to my experience, you can see many more hybrid solutions. So for instance, you have a medical device that has, for instance, inbuilt AI algorithm, or you have a certain therapy that is, let's say, embedded with, you know, compliance, or let's say engagement tool that is based on app or any other software that is simply helping medical staff to keep engagement and retention of the patients in the therapy more. So these are the trends that at least I'm observing, and I think when it looks to, and again, I will make this connection to whether partnering with pharma is a recipe for success. Again, I would say yes, but here you have to really track what is happening out there in the market. And here strongly, of course, I would strongly encourage both to and I will repeat myself, to look at the unmet clinical needs, but also to look how, let's say, large corporates are trying to solve it, because their let's say market access power is much stronger than a startup, which doesn't mean startup is always, let's say, on a bad position to compete, because startups usually have that ability to build agile projects and much quicker deliver certain milestones. So look at the technologies, track what is out there. I mean, majority of that research is anyway available publicly for the publication. So I would really encourage you to do it. And I think that leads me to the part in which I want to address more, let's say, on kind of specific thoughts on basically what you can do with your project if you want to be, let's say, better understood by big pharma or any other partner. I think some of these thoughts, you will find them maybe obvious on universal, but I hope you can use them in that specific context of working with big pharma. So first of all, I want to speak about, let's say, general principles of how to communicate. So basically, I mean, everybody that had or has or will have a project, and I said, if you're ambitious enough, you're going to, I mean, you're most probably able to die for this project because you spend so much time in research in the lab that, I mean, this is something that you really want to defend. But you have to know that if you're going to another partner, to another organization, I mean, your efforts might not be recognized, let's say, in a way that you would be expecting this. So you have to be constantly ready for that, let's say, evaluation or basically feedback process. And on the other hand, if you're going to organizations such as big pharma and you're a startup or you're coming from university, you have to understand what is the language, the values, and the internal landscape in the organization. I'm going to give a couple of hints in a few minutes, but this is where I would start. So you have to be clear in what your communication is about. So, I mean, what is the solution? What is the unmet need you have identified, and basically what kind of problem you're trying to solve, to whom that problem belongs. So I will just address it in a few seconds as well. What is your value proposition? And here you have to understand that this is not only value proposition of your company, but what is the value proposition for your partner? So basically, why should I do this business with you, not with someone else? Another point is obviously a business model, because normally if you go to corporates, they will have people, or at least competences, in order to evaluate whether you have been thinking about your project, not only in terms of research, but also how much you can earn money, or at least that you have certain idea how to do it. And also, what is now, let's say, a growing trend, probably a lot of you have heard about value-based healthcare, is basically to justify what kind of value your solution is bringing to the healthcare system. So basically, how you're going to impact the quality of care for the patients. To what extent, let's say, medical staff will be able to see or simply address that your solution is changing or improving for instance, the diagnostics or treatment pathway. So these are a couple of elements, quite general, but I will try to address them later. This is, let's say, what we have done. I think this is just let's say I would say half of our portfolio for the last 5 years. I mean, I'm just putting this because I mean that shows certain trends. So we had, I mean, obviously we have a lot of projects with large corporations on MRI and radiology. So we had a fantastic presentation before break about these solutions. So these are, let's say, topics that are normally kind of recurring when it comes to collaboration with large companies. We also have diabetes and CVD as one of the major conditions where large companies are trying to simply introduce new or optimized care pathways for the patients. And we obviously, I mean, because that's kind of in the DNA of our organization, we had a lot of projects in diagnostics, in early diagnostics, and I will give you one example of these. Obviously, a lot of medical devices in a chronic treatment. So I think that's quite interesting. And in 2020, obviously, we have launched the high-value care forum linked to value-based healthcare model. But again, I'm not going to spend much more time on this today. But let's say Kasia was asking before, what was the impact on COVID? We also were addressing that need. So we have been calling for projects related to COVID-19, let's say fast track for innovation. And we had, let's say around 20 projects that we supported last year. Very different, you know, AI tools to support the medical staff in detection, but also, you know, elements of education in a USG, in a lung contamination. So different type of solutions out there. And somehow that leads me to a place where somebody of you may ask, okay, well, but super, I mean, you're talking all about the things, but okay, I have my team, I have my project, but basically, how should I shape this project in order to make it attractive? So basically, I mean, this is a piece where I can give you some tips. And obviously, I'm not alpha and omega, but I believe these are a couple of tips that I believe if you try at least to discuss it within your team, whether you have these elements or you have been discussing them before, or you have been having any kind of reflection around these, I guarantee you're going to be able to improve significantly your project. So proposal preparation or project preparation, or at any stage, go and ask key opinion leaders, talk to medical staff, talk to the people that can really tell you whether what you're trying to address is a need, who owns that need, how big is this problem, and basically how it has been solved so far. So I think that's quite important. I'm mentioning here 5 to 8 interviews with the key opinion leaders, which is, I'm not going to tell you this is a, let's say, a maximum or minimal number. I'm just saying this is where you should start. So the more interactions you have, the better. But I think this is the kind of level where, I mean, it's really hard to move your project forward. You will have to pitch your project many times. You will have to show clear achievements within your team and within your project. I think Mikołaj and Paweł, they have been discussing about presenting the project in a different way. So this is not the research pitch. This is definitely a pitch about your achievements. And when you're speaking to big pharma, this is going to be one of the major parameters of your success. Work plan. So in a work plan, it's more about looking at the what you're planning to do. Basically, what are your milestones? Whether you have planned your risk analysis in a proper way. I think I tend to see many companies, let's say, losing attention, or let's say losing, not tracking many risks like technological, regulatory, clinical, or business risks. So it's not about, you know, killing the project, you know, at all, but it's really about looking and mitigating the risks. Type of the project, basically, I mean, this is a perspective of our organization, but this very much, let's say, reflects what big pharma is looking for. So it's not about research, it's really about market facing. So focus on outcomes, look at whether you can bring any cost reduction parameters into your project. You might also look at the system or organizational changes that your project might introduce. So it doesn't have to be always a device or, let's say, new therapy. It might be an optimization of patient, for instance, flow in the hospital or in the ER. So look at the project from different angles. Science has to be strong, and I think just previous, let's say, presenters, they have been also mentioning that. So I said it's not, I mean, these projects are not about research, but without strong research, you're not able to bring, let's say, good innovation to the market. Commercialization, which I believe is one of the, let's say, critical elements of your, let's say, pitch to the pharma, is, at least that's my perspective. This is the way I work with the project. So making this horizon of 3 years, so where our project is going to be in 3 years and how close we can be to the market, I think it's quite important, because that shows certain commitment and energy that you have in the team to deliver something. In healthcare, you always have to define who is buying, who is using, and who is paying, because, and who is providing, because that's not so clear that this is normally, that's not always the same organization, and that you have also identified the impact on, let's say, commercial side of your project, but also on the social one. So basically, how this would impact the society. I mean, if you're speaking about certain conditions, I mean, it's always relatively easy to calculate how you're impacting certain part of the market when it comes to condition or disease. Yeah, partners, I mean, that's quite obvious, but I think we can look on that from, let's say, different angles. So to what extent, to what extent you might simply have all the competencies in your team, but with whom you should partner. Clinical validation is, I think, quite important for some technologies or for some innovations. Without, let's say, phase 1, many pharma companies would never start talking to you. So this is why I said that this is not always the recipe for success, because it might not be, I mean, this level might not always be achievable for every startup, but this is quite important. Yeah, and budget, I mean, obviously, I mean, you have to know how much needs to be invested. So these are a couple of, let's say, elements that would leave here. And yeah, and here maybe 2 examples. So again, you will get these slides after the webinar, so you can look at some literature that is linked to this, but 2 examples of projects, at least I believe, are really well, let's say, shaped when it comes to, coming from need, identifying the solution and deploying it to the market. Actually, this first example, Stockholm 3, is maybe not, let's say, directly linked to the pharma, but I can tell you that major lab, let's say, providers in Europe and globally, they have been engaged in the project from the beginning, because the innovators behind that project understood clearly that the way they're going to deploy their easy blood-based prostate cancer test has to be designed in a way it might be easily adaptable to diagnostic platforms of companies such as SynLab or Thermo Fisher. So I'm not going to go through the details, because I mean, I hope everything is clear here, but this is really one of the examples in which you can easily see that if you detect the problem in a proper way. So yeah, prostate cancer is one of the most, let's say, invasive types of cancers, but actually the standard of care is to do the biopsy. Biopsy is really not pleasant, and obviously if you can find a different way of detecting the prostate cancer earlier, then you can send only the man who need to have a biopsy just to confirm what is basically the status of the prostate cancer. So I mean, these simple elements shows that you can really build, let's say, innovation, and you can really, deploy it to the market. So Stockholm 3 was launched in Sweden, but after this, they really quickly went to Norway and to the other Scandinavian markets. And now they're also available in Canada, and also they're going to deploy their test in Germany and France. So obviously, if you ask me, is that recipe? Well, yeah, in their case it was, well, maybe not pharma, but very close to that. But this is really, I would say, maybe this is a recipe somehow really to build your solution from the beginning, having this in mind, that this is the way I'm going to sell it. this is the way this is going to be, let's say, landing in the lab or in a hospital, in a primary care center, or at patient home. Another solution is Muvut, which is the solution that is, let's say, helping in a chronic constipation. So I mean, I just put a photo so you can have some, let's say, ideas basically how this device works. But again, this is something that I believe is also really good example on how you can, you know, build the solution, design it in a way it's, you know, acceptable in the market, and you're simply, let's say, putting yourself in a niche, and yeah, and really it improves the quality of care. You can really have outcomes that really impact patients directly, and they're really, let's say, transformative for the healthcare system. So yeah, basically our role, again, as with the Stockholm 3, was to reduce the time of this solution from, let's say, lab to be deployed in the market. Okay, and yeah, probably you'll ask, okay, how to do it? Because basically I just really, I mean, I would like to know where my project is, or basically how I can measure basically whether I'm going in the right direction. So as I said, my speech is not only just to, you know, speak, but also to give you some kind of concrete tools that you might use. So that's another one. So in the EIT Health, we are not using technology readiness level methodology because, well, let's say, we believe it's too flat. So it's not showing the depthness of and complexity of healthcare innovations. We are using CIMIT maturity matrix, or what you can see on the right side is a CIMIT innovation cycle or whatever template. We got it from the CIMIT organization from Boston in USA. We have, let's say, I think 4 years of really successful collaboration on evaluating and looking at the biotech, medtech, and digital health biopharma projects from a different angle when it comes to maturity. So on this IML maturity matrix, we have defined 4 levels of maturity. So technology, regulation, market, business, and clinics. And this is, I think, really interesting tool I'm obviously not going to go into the details because you can see we have 4 levels. Each level has, let's say, we have 4 levels, but then we have four areas. Each area has 10 levels. So I'm not going to go through each of them. Again, I put the link. There is also an online tool where you can do, let's say, free of charge first, let's say, self-evaluation. And if you want to learn more, I'm happy to do it. But this is something that really at least helped me to understand better where certain projects are. And you can really look at, you know, where we are with our business, you know, how far we're in the clinical development, how much we have investigated the regulatory pathway. So basically, do we know who is going to, so how we are going to register our solution, and how fast it might be simply reimbursed, or whoever else is going to pay for this, and what is the milestone. And that really helps to navigate your project in a proper direction. So I think this is one of the tools with which you can really look at your solution. And this one in particular has been designed for medtech or biopharma digital health solutions, which I think is unique. So you don't have to use something that is just moved from the other, let's say, general business development, let's say, domains or literature or experience. This is specific and has been proved both with the large organizations, big pharma in the USA, but also startups, clinical teams in the USA. And now this model is being deployed to Europe. So I'm not saying it's a receipt for every, let's say, trouble, but definitely CIMIT maturity matrix will help you to better identify where you are and where you're planning to be, whether your pathway is a right thing. So I'm really not far away from ending. So just really a couple of final words, because yeah, I you know, some of the messages I have still left to present are, let's say, overlapping with what I have said. So how to work with a big pharma, and this is one of the, let's say, so I'm already, let's say, wrapping up and we're landing. And I'm happy to hear some of your questions. So how to work with a big pharma. So just having in mind that I said, this is not, I mean, it really depends whether that is going to be a right pathway for your company. You always have to have a leader, the team and the leader. So, I mean, do not try to work with these large organizations if you're alone, because simply your capacity will be even if you're a startup, this is going to be always a lower capacity, but you need to have a leader, so somebody who is going to keep on dialoguing with your partner in a big pharma sector. But you also need to have a team. Otherwise, you probably will be swallowed very quickly, or simply you will not gain enough interest. You have to showcase that the maturity of your technology and how effective it is. So please be prepared for doing benchmarking, also by looking at the other conditions. So I know if you're working in CVD, look what is happening in the neurosciences. If you're using AI in, neurodegenerative diseases, look how AI is being used in the radiology. So really look at your technology in a way. It's not only within the, let's say, small, piece of what is happening in healthcare or in innovation. I just try to look broadly, because your country partners are very much aware of what is happening out there. Business scalability. So, in this sense, I would say these large companies are also very much interested in basically whether they're able to do any money. So obviously they're ready to invest, and I would say in many cases their ability to take a risk is much higher than within the other, let's say, available instruments. But you have to be precise on how you're going to scale your business. So we are returning back to the business model that I mentioned here in point number 5. I already mentioned that you should be aware how knowledge is being stored in the corporation. What are the internal relationship between the units? So if you start with the R&D, how fast you're able to get to the business development, whether you're going to speak to their marketing department. For instance, if you're accessing the big pharma for the hospital, that is the client of that company, you should really know who is the key account manager. So somebody who can help you to open the door within the corporation. That's extremely important. If you can, invite some of those people to your advisory board, or at least engage them as an expert. Many of those people are happy to do it even for free. So LinkedIn is absolutely a right place to look for these people. Just do it. Do not hesitate. That will definitely help you to build up let's say, reliable connection and relationship. I have been talking about the business model, but I think this is also kind of check whether you have really done your homework well. So for instance, if you're addressing specific treatment, you should know in which business model this is being developed. So if for instance you say and you start speaking that you're going, hospital is going to pay for this, but you don't know basically how the reimbursement system for that concrete procedure works, that will be checked very quickly by the experts inside the company. And last but not least, find a sponsor of your project in the company. I think I said about this. There has to be somebody who is going to be, let's say, equally committed to help you to make this project happen. So, I know that's quite obvious in any organization, but I think that's quite important. This slide I would not go through, because I think this is very much linked to what investors are looking for. This is very much dedicated to the team. I think that has been addressed already by my colleagues before. So you will get this. But I think this is something that I already mentioned when it comes to team people. Whether you have that chemistry, whether you look as a team that is you're really capable to deliver something for the large company. So bear in mind that is not only important for big pharma, but also for the investors as well. So we are not addressing this, at least in my speech today, but I decided just that I have this couple of thoughts for you. And wrapping up, what innovators do usually forget? So I put these 3 elements here, which are really wrapping up what I have been trying to convey in the last couple of minutes. So value proposition, telling your story. I spoke about the communication. What innovation must have this is what I said: unmet clinical need, the solution, looking at your competitors. I think it's quite nice to, for instance, use this lean canvas model really to look at your solution in a bit broader perspective. So for instance, who can substitute you, what your customers are challenged with, what kind of impact you're creating. I think that's really nice tool to really look at your startup in a bit different way. and people in the team. So I think for me, that's a key element. Obviously, I mean, you need to have a strong research, you need to have a good solution, and you need to have all the things I have been talking about. But I mean, people and the team are crucial. And as we are speaking today about the introduction to Polish ecosystem, really as a last message, I just want to tell you about the initiative that at least we have been engaged with a couple of organizations in Poland. The initiative is called Warsaw Health Innovation Hub, which is one of the first public-private partnerships in Poland dedicated to healthcare innovation, where actually our organization, United Health, is trying to, let's say, inflate knowledge and experience we have in Europe. But I just wanted to say, if you're thinking to work with big pharma in Poland, this program might somehow be also a good, I would say, a pit stop for your company. As you can see, we have engaged with AstraZeneca, with Polpharma, with Roche. So large pharma companies. I'm hope that we will have another ones coming. We also have the hub under the umbrella of Medical Research Agency. So in Polish, this is Agencja Badań Medycznych. So at the moment, the dedicated public-founded agency that is dealing with clinical trials, non-commercial clinical trials, with animating biotech and pharma environment in Poland. So this is just, let's say, a showcase on the potential we have been able to gain here. And this is the way we work. So in the next couple of weeks, we'll be hearing about the calls and the projects launched by the partners of the hub. And we're really focusing on addressing a couple of challenges or priorities that I mentioned here, such as lung cancer or using telemedicine for improving healthcare system. 12 months for the projects, for the pilots, and then we're hoping to have first scale-ups to the Polish healthcare system in a strong partnership between private companies and the public sector, which I believe is a unique opportunity. So just if you can track us in social media, but also visit our website. You can also visit the website of Medical Research Agency. There are more information about the program and the initiative, which is obviously open for startups as well at a certain point. And we hope to invite startups soon to present their projects, which we will co-finance together with the public and private stakeholders. So I think Poland gives a lot of different opportunities for the startups, including working with the big pharma. It's simply just to find your way. And as I said, it really depends whether this is the way to work for you with the big pharma as a startupper. So I hope you enjoy it. Thank you for your attention. And if you have any questions, I believe we still have a couple of minutes for that. So thanks a lot. Kasia, I think back to you.
Yes, Mikołaj, thank you so much for the whole fast track through ultimate experience in a Polish market for startups. I think it's very hard to ask questions to this presentation because it's been so detailed and, like I said, so fast track that it seems like you've exploded the majority of topics and questions. However, I am gonna ask that into the public. Guys, do you have still some questions to Mikołaj? It's quite an opportunity to ask a question, to be able to hear from an expert with such a extensive experience on technology transfer and funding as well. So.
Yeah, I'm just now just putting the slides into the PDF. So I think I can share it in the chat, but I don't know whether people would be able to download it. Let's see.
Yeah, let's check it out.
Okay, I will try to do it.
Yeah.
So, and I will also post my email address in the chat shortly, so you can also. You can also use it. Okay, I think my presentation is already in a chat, and I'm also putting my email address. So do not hesitate to contact me. And if you have any, let's say, extra questions, let's say offline related to our programs, I mean, I'm happy to let's say address them individually if you want. So no problem at all.
Okay, thank you so much, Mikołaj. Then thank you once again for your voice and your time, and this extensive preparations you had to put into this presentation. Thank you so much.
You're welcome.
Okay, and I think we're coming to the end slowly. And the next person I'm going to make a co-host and ask to the stage is Piotr Iwanowski from startup OISIS Diagnostic. OISIS prepared Oniri medical device, it's called Oniri, that helps people, women, detect and properly diagnose perinatal injuries just after natural delivery. Yeah, so Piotr, I think I will actually leave the floor to you and give you the voice back. And it's really nice to see you. It's really nice to welcome you, and we're ready for your presentation. Thank you.
Okay, thank you. Good afternoon, everyone. Thank you for inviting OISIS Diagnostics and myself to this meeting, to this conference. Let me perhaps present myself very briefly. I'm a physician. I'm a PhD, actually clinical geneticist by background. And my core profession is being a drug and medical device developer, purely within the clinical development scope. So I'm more, from the scientific than the business angle in the story. And my expertise is design and methodology of clinical trials, mostly in the commercial context, which means that there is a lot of regulatory science we deal on a daily basis. And as you certainly know, all these markets, I mean, the biotech, both the medicinal products or drug development environment, as well as medical device, are highly regulated or actually even over-regulated. I haven't personally been exposed to procedures and proceedings with both the European Medicines Agency and the US FDA, and I'm more than 20 years actually in this business. And I'm with OISIS Diagnostics since more than a year, so actually it's not too long. I'm not the founder or co-founder of the company. I just joined the story, and my role is and was and is to design, to lead, and to advise on the clinical development of the Oniri medical device, which is the company's baby and main product under development. And the clinical development is currently at its full speed, as our pivotal clinical trial has just been recently started. So I have not prepared, any formal presentation. I would be rather open for a discussion, as it is actually rather the end of a long day.
Sure, no worries.
For all of you, and also would be happy to answer questions that you or the audience might have. Actually, the introduction you have provided says a lot. We are developing a medical device, which is actually it's not an implantable medical device. So its development is relatively simple if you compare it, for example, to a full development of an innovative medicinal product or of a drug. However, you still need to develop it at the non-clinical technology and then clinical level. The clinical development is somewhat simpler if you compare it to the drug development. You don't have formal clinical phases like phase 1, phase 2, phase 3. You have rather you call it a pilot phase, when you need to prove your concept, a proof of concept phase, and then a pivotal phase where you conduct one or sometimes a few clinical studies to establish the performance of your product. And our product is actually, we consider it as a non-invasive, at least the technology which is in it is non-invasive, which is electrical bioimpedance. Actually, you can find this technology being utilized even in household appliances such as scales. If you want to measure your body fat in a fitness room, for example, this would be done actually using the same technology. I mean the same technique from the biophysical standpoint. However, from the formal point of view, because this electrical impedance is measured in the body orifice, which is anus, regulatory wise, we already fall under invasive. You are in the invasive scope, which is just an example, how far regulated this market is, and how sometimes, even simple things could be not that simple if you look at it from the regulatory angle. So we are currently performing this pivotal study. Okay, so it is expected to be the only pivotal study. So after getting its results, we should be ready to market, to commercialize the product, or at least to get the marketing approvals or authorizations. And we are doing this on our own. Means we do not have or do not have yet any partnering for this process, which is definitely different if you compare such a startup development stories in biotech, again with the drug development, where it is actually not feasible for a relatively small or even medium-sized startups to conduct the clinical development of a product until commercialization, without getting a middle or large, big pharma partner, because of the capital which is required to generate all this data, including a large phase 3 clinical studies. So in that context, the medtech or medical device development could be still feasible to be done, without a major partnership at this place yet. What is quite unique, however, it is of course more and more used within the biotech developments, is that our product is not just a simple measurement of electrical impedance, which will reflect or give us or the physician information on the structure of the anal sphincter, but it is also using the machine learning within it. So let's say part of our product is the medical device itself, the physical device, and part of it is the software, which is part of it. As it is not that straightforward, okay, the differences in electrical impedance between injured and non-injured tissue are so fine that it is not that simple to distinguish it, and it was early realized within the whole process that the support of machine learning would be or should be needed to achieve sufficient performance as measured by sensitivity and specificity to get close to the reference diagnostic methods for for this condition. I mean the obstetric anal sphincter injury. However, what we develop, so the product we are developing, will have expectedly comparable performance, so comparable sensitivity and specificity. However, it will be far easier and far cheaper to conduct as compared to the reference technology, which is actually not easily available, but easily accessible, time consuming and expensive. And this is actually why the issue of obstetric anal sphincter injury remains a widely undetected condition if you look at the population of women who have given natural or vaginal delivery. So our product is to fill that gap in the diagnostics by providing a kind of simple 1 minute diagnostics of the condition, which expectedly in the future, so after commercialization and after possibly generating even more data on larger populations, could be used as a screening method for virtually every delivery or obstetrics room in the country or even in the world. So this is the vision which is behind. This is the technology which is behind. I would be rather happy, perhaps, to discuss or to answer your questions if you would have any.
Sure, we wait for the questions. I think at this stage of the day, everyone's a little bit tired, and we're slowly coming to the end. So maybe this session needs to be a little bit shorter than planned, and since we were anyways a couple of minutes ahead of schedule, we have some time saved. In the meantime, I will ask you about targeting customers again. What do you think is the best way for your startup and like medtech startup in Poland to do that?
No, I'm not a business guy. Okay, so I will be talking rather more as a physician.
Yeah.
Yes, about the physician. Being actually historically even at the other part of the scene, or at the other part of the battle, so being targeted by various marketing or sales techniques. So I'm definitely biased in that. So of course, first you need to realize who is your customer based on your product. Is it the wide public? Is it an OTC product, over-the-counter product? Or are your customers, physicians, or maybe hospital directors, or chief physicians, or head of departments? So in case of our product, it would be definitely rather the latter population, so hospital directors or head of departments of obstetrics, who would be the decision makers. So in a way, they would be our customers. So of course you need to find a way after successful commercialization to to sell this product or to make them acquainted with a new product. And what I personally, but again I'm repeating, I'm biased. I'm not a big fan of direct or aggressive marketing or sales techniques, especially that these are, of course, very expensive if you are targeting, let's say, an international, the international market. Okay, this needs to be so local marketing and sales forces would be, you need to be hired and maintained and trained locally, as it should always be conducted in the local language and so forth. So this definitely would be a big and maybe too big challenge for a startup. So my point, or our vision, is rather to start targeting the customers rather from the scientific publication angle. So in parallel to developing our product, we are very active on the scientific field. We have already 3 major publications in English, of course, in respected journals that have been published. The 4th publication is underway, and we are still, yet at the beginning of the pivotal study. So we started building a group of physicians, a group of obstetricians or surgeons, who first of all, who are aware of the clinical problem and who are, visionary enough to be open to a new technique or a new solution for the clinical problem, which is definitely there, and for which there is definitely an unmet need. And we would rather believe that such a group of physicians or prospective key opinion leaders for such a technique would be the best way to start your development. So I think this is something that is sometimes not sufficiently recognized when you are developing a new product in the biotech. How important is that you have a proper or significant record of published papers in medical journals, which should be of course followed by also conference abstracts or conference presentations, to make it visible, but also to clearly present the science which is behind.
You know what? It's actually a lot of detailed answer for a person who's out of business and only in research. So I think it's not that bad as you described. However, maybe with some more visionary kind of question. So I'm thinking systems like OASIS, like yours, basically based on artificial intelligence, seems to be super precise. So how do you think will look the future of diagnostics? Like, are we talking about excluding the human factor from here?
Hopefully not. Me, as a physician myself, I would not be happy to be excluded from the healthcare system. However, of course, there is a tremendous field for support that physicians would get, from the machine learning or even from the full-size artificial intelligence, support. And the diagnostics, I think, is a perfect field for that battle, perhaps even more than the treatment. Or I would guess that the diagnostics would be, or that is actually happening. It's not the future. It's actually the presence, the real time that we live in. It's first of all diagnostics, and then after it comes the treatment and prophylaxis or prevention of diseases. So definitely the future is there, and even regulatory wise, if you look at what is happening at the level of at the EU level, of the market regulators. So as everyone on this call may know, the regulatory landscape for medical devices has changed dramatically a few months ago, as the new medical device regulation has came into force, and a new a new body, or actually a new body, the old body with a lot of new tasks and responsibilities, which is the Medical Device Coordination Group, which is a kind of European regulator, is starting developing a lot of guidances, a lot of new rules for this market. And one of them is namely the artificial intelligence. So what the Medical Devices Coordination Group, as well as the European Commission itself, are working on is, is how to regulate formally the development of, or the implementation of artificial intelligence in the science, in the in the commercial science, so in the development of products to be marketed. So this is perhaps the best proof, or the best example, that it is really happening, and that such products are or will be welcome on the market. Okay, now already, as of now, you can market just the software as the medical device. So the medical device could be software by itself.
All right. Okay, and I think I'm leaning towards more questions related more to law than research right now. And I wanted to ask you about the certification process, how it looks like for ISs.
You mean the certification process to get the product on the market, right?
Yes.
So,
yeah, exactly.
Yeah. So as again, we are at the time of a big regulatory change. As an example, our pivotal study has been initiated shortly before the formal applicability of the new European regulation. This is why it is still governed by the old laws, by the old directives and national laws, which is also, of course, the case for many other medical device clinical trials, which are currently ongoing or are being initiated. However, once we get our data, and once we go to the notified bodies or a notified body to get our data audited and hopefully get the certificate for marketing authorization, this will be already under the new regulation. Definitely, okay. The new regulation has changed a lot. I'm not a regulatory person by myself. However, I'm at least roughly, aware how much has been changed, also including the non-clinical and clinical development of medical devices by itself. What is very clear, and what could be observed even, about the recent few months, is that the new body, the Medical Device Coordination Group, is very active and is generating a lot of new guidances and drafting as a lot of new guidances. And if you compare the regulatory science, which is all around the development of a new drug, you will easily observe that there are hundreds, if not thousands, of various guidelines issued by the two major regulators in the world, which are the European Medicines Agency and the US Food and Drug Administration. Okay, so if you are planning a global development, you have on top of laws, you have hundreds or even thousands of guidelines, okay, so which are not formal laws by themselves, but which are, of course, very important and binding and critical to succeed if you plan your development. Compared to this, the regulatory environment for a medical device development is far shorter, far smaller. I mean, there are just a few dozens at the most of guidances in the European space, at least. But the new body under the new regulation is very active, so we can be pretty sure that, you know, in a few years this area or this market will be much higher regulated than it is currently, as it is as of now. So, you know, the environment is changing, and I think the environment, regulatory wise or guidance wise, is even more rapidly changing currently for medical device developments compared with drug development.
Okay, and what comes in a package, that question, is a question about IP protection. And what do you think is the role of IP protection in developing startup in Poland? And also, how long does it take? How problematic it was from the perspective of practitioners?
I would actually give you quite generic answers, as I'm not an IP, you know, expert. That it is of course critical. You need to secure your IP as early as possible. This is, I think, what everyone in this meeting perfectly knows. You can't actually do it yourself. You need to, you know, to have a credible and experienced partner, knowledgeable in all these IP affairs. But at a certain point of time, rather early in your development, you need to ask yourself what is the scale, what is the scope of your development, in which areas and to which scope you are going to secure your IP, as it really involves time and money, and maybe even money is critical in that process. So if you wish to secure your IP, your patent, or trademarks or whatever, truly worldwide in all possible, you know, geographies, it would be unfeasible, definitely, for the smaller startup to do so. So you need a strategy, right, to focus on critical markets, on critical areas for your development. And this is actually what definitely happens or has happened so far at Oasis Diagnostics.
Yeah, it's crucial and very important, like you said. But I'm also thinking, if you could imagine that you're waiving any legal provision in Polish law, like what would that be? Meaning, what would you delete from the Polish regulations that would make everything easier, and now is making everything harder for you? I'm thinking like the biggest obstacles in this category.
Okay, but do you mean IP wise or just in general?
I think in general.
In general.
IP, yeah. With IP, I'm
okay.
not gonna be making you talk more about it, since
yes,
you told
please.
at the beginning. Yeah. So.
The example of Poland at this moment of time is quite spectacular, because if you look at the medical device regulations, the situation is unprecedented because it's totally chaotic. The medical device regulation should be implemented at the moment where the old or to date national laws are cancelled or radically changed, so that they are adapted to the medical device regulation. This is what will hopefully happen in January, February next year for the medicinal products, for the, at least for the clinical trials of medicinal products, drugs, where expectedly or apparently Poland will be sufficiently prepared, as the national law, the parliament law, is already underway and is already finished enough, already enough, you know, to be proceeded and to be on time with that. So there will be rather a smooth regulatory transition. this has not happened for medical devices, and as you may, or most of you, as you may know, the medical device regulation has been implemented, but the to date Polish law on medical devices has not been modified or changed. So if you look at the clinical trials as the example, the situation is completely chaotic, because the old local Polish law is still in force, and in many details it's completely divergent or discordant with what the European medical device regulation states. So sponsors of such studies or even investigators can be fully confused about, you know, what is currently applicable as the law. So this has clearly some political issues, which are by the way not related to clinical trials or clinical developments, but rather to the marketing or promotion, advertisement areas. These are perhaps the most problematic for the Polish market. The effect is that the whole regulation has not been updated, and this situation is apparently not going to be resolved very quickly, as this the new law, which is already being constructed, which is has been drafted, but is, to my best knowledge, maybe I'm not sufficiently up to date, has not yet reached the national parliament. So we are at least several weeks, if not months, before the new regulation is in place.
Okay, so I think we're slowly coming to the end, seeing as even like the number of attendees has been a little bit lowered, minute by minute, and it's like presentation by presentation it goes down, probably meaning that the day is coming to the end and we need to wrap it up. So I have final questions for you, and those are the standard questions about the COVID situation and how it affects your startup. Did it affect your startup, and how do you think it will and is affecting the healthcare startup ecosystem in Poland in general?
Specifically, just for our company, of course, it has affected. At a certain point of time last year, it has severely affected the development, as the pilot study, clinical study, has to be practically suspended because of the pandemics, and it was not feasible to conduct the study. It was actually even required by the regulator, by the national regulator, to suspend the activities. So yes, we've been affected. However, this break was not too long, so this generated rather a little, if not a slight delay, in delivering the results of the study. So far, so good. I mean, currently we are affected by the COVID situation at the various, just looking from the clinical trial perspective, because this is our core activity at this moment. It certainly affects the feasibility of the project, but it doesn't make it unfeasible, at least, for such type of population, for such type of study that we are conducting. But there is, and there will be, a number of hopefully minor obstacles that you need to cope with. Just as an example, we had to initiate an investigational site earlier this year, before the formal vaccination certificates were issued for citizens, and we had to do it in a neighbor country, so not in Poland. and we got just an 8-hour slot to go there and come back, whereas there were no suitable operating flights. So, you know, just as an example how sometimes agile or flexible you need to be as a startup personnel to do some you know, activities just within hours, because we would be otherwise quarantined in this country, and this would affect the product. Just an example, but yes, it does affect. I'm definitely optimistic, you know, for at least for the upcoming year, that the pandemic will be over. Of course, the prophecies or the prognoses are quite variable. Again, the clinical development environment, so this is what is personally closer to my activities, you know, has been actually shocked or even paralyzed in early 2020 by the pandemics. Now, actually, everyone, starting from the regulators, startups, companies, sponsors, CROs, vendors, clinical sites, clinicians, actually learned, you know, how to live with this. So the situation in all over 2021 is definitely better, more stable compared to 2020. So I am actually moderately optimistic.
Yeah, okay. Thank you very much, Piotr. Thank you very much to you and to Kasia from Oasis team, who were very kind to prepare for today's meeting and to sacrifice some time and deliver this speech. It was very nice to listen to you. Thank you all also attendees. Thank you all for being here and staying here with us today. I think for today we can say we're done with the topics, we're done with the webinar, and well, I hope to see you soon. I know it's been a long day and that we've all been here since 1. So thank you all once again for spending this time with us, and see you soon.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye-bye.
Bye.